And a good morning to you. Of course, it is the month of May. Big welcome to you. And of course, a big welcome to our resident medico, Dr. Clara Chu, who is live with us this morning in the studios. We are talking another big topic health-wise as well, thyroid disease. And Dr. Clara, great to have you back in this morning.
Yeah, thanks for having me again.
Yeah. So look, okay, so let's jump right into this because this is something that's kind of close to me as well as somebody who does suffer from thyroid disease. A lot of people in my family as well, and I know other friends who have this one. So, firstly, tell us, what is the thyroid and where is it located in the body?
Yeah, so the thyroid is a small bow-shaped gland that sits in front of the neck. So imagine kind of like a bit of a bow tie, and it sits just below the Adam's apple.
Sure.
And so the two sides of it kind of sits on either side of the windpipe.
Right. So even though it's only a pretty small one, you could say, relatively speaking, what is its function and why is it such an important gland?
Yeah, so it produces the hormone triiodothyronine. So it's a bit of a mouthful. We call it T3 because it's a lot easier. And so that's a hormone that controls our energy levels, our temperature, our metabolism, our heart rate, our blood pressure. And the development of a fetus. So you can, from that list I've just rattled off, these are all like essential and basic functions of the body. So can understand if the thyroid goes wrong, a lot of other things can go wrong.
Now, thankfully, I don't have to worry about the development of a fetus part, but obviously all the ladies out there do, but it's all the other things too that you do know can fluctuate at different times. So what are some of the more commonly known diseases associated with the thyroid?
Yeah, so the three main ones are hyperthyroidism, which is the thyroid being overactive.
Sure.
Hypothyroidism, which is the thyroid being underactive, and thyroid cancer. Now, you'll also hear of other thyroid problems that we can diagnose, like nodules that grow in a thyroid, an inflamed thyroid, or an enlarged thyroid, which is called goiter. And then these other conditions, they can sometimes cause hyperthyroidism. Sometimes they can cause hypothyroidism.
Right. So those two particular terms, let's get that out on the table this morning.
Yep.
What is hyperthyroidism and what is hypothyroidism?
Yep, okay, so let's start with hyperthyroidism. So as I mentioned earlier, that's when the thyroid is overactive. It's making too much of the thyroid hormone. And the most common symptoms associated with that would be feelings of anxiety, being nervous, not able to tolerate the heat, heart palpitations, feeling tired and losing weight even if you're eating the same amount of food. So imagine someone who's kind of anxious and jittery and hyped up is the picture that I picture when I'm thinking hyperthyroidism. And hyperthyroidism is sometimes called thyrotoxicosis, which is, too much of the thyroid hormone. Toxic. Totally. And then you've got hypothyroidism, and that's when the thyroid is underactive. It doesn't make enough of the thyroid hormone, and so that can go for years without showing any signs. But when symptoms do appear, they can be quite varied. So that can include feeling fatigued, being unable to tolerate the cold, feeling constipated, dry skin, weight gain, poor memory, and depression. So just think of kind of almost a bit like a sloth, very sluggish, very slow, low energy levels.
So, Dr. Clara, are they genetic conditions or can they be prevented with lifestyle choices?
It's likely to be a mixture of the two. As with a lot of things that we've talked, all the different diseases that we've talked about over the last number of months, it's quite often a mixture of the two. So some of the causes of thyroid disease are iodine deficiency. As a result of iodine deficiency being quite common, iodine is now an additive in table salt that you can buy at the supermarket. Autoimmune diseases, so that's where the immune system attacks the thyroid. This can either cause Graves' disease, which then is an overactive thyroid, or Hashimoto's disease, which is an underactive thyroid. But either way, the immune system is attacking the thyroid. And there are blood tests that we can do to work out which one's causing the problem. There can be just general inflammation that can be, because of a virus or bacteria that's again triggered off the immune system somehow. People can get nodules, so they're non-cancerous lumps, generally benign, but again, they can turn the thyroid, make the thyroid work a bit harder and
Sure.
and become overactive. There are cancerous tumours, and then certain medical treatments like radiation therapy, thyroid surgery, certain medications can cause thyroid disease. And then, of course, there are genetic disorders,
Sure.
that can cause thyroid problems as well. So, there's a whole heap of different things there, a mixed bag. Some of that we can control, like the lifestyle stuff, but a number there that we can't really control.
Absolutely. Well, we are talking about thyroid disease this morning with our resident medico, Dr. Clara Chu. We will be right back after this short break to continue on this fascinating subject. This is Rhema Brekky. Stay with us. And welcome back. We are joined, of course, by our resident medico, Dr. Clara Chu, in the studio with us this morning. We are talking all about thyroid disease and some of the conditions associated with that. Now, Clara, who are they most likely to affect?
So there are a number of risk factors for thyroid disease. So being female, seem to wear it a lot. There's a few other conditions out there where there's a big female preponderance.
Yep.
Those with a family history of thyroid disease. Anyone with already diagnosed with one autoimmune disease. So we're talking about things like type 1 diabetes, which has an autoimmune origin, or celiac disease. Those people are more likely to develop a thyroid issue. Anyone who's received treatment for hyperthyroidism can then suffer from hypothyroidism. And those who have received radiation to your neck or your upper chest, because that can affect how the thyroid functions. And for anyone who's had thyroid surgery in the past.
So what kind of tests can be performed in order to get a diagnosis?
Yeah, so we can do a whole host of blood tests to check the levels of the various thyroid hormones. And then we can also do a couple of different scans to make sure that we're not dealing with a thyroid cancer. So, in my clinical experience in the last 12 months or so, I've picked up a number of patients with, either nodules or enlarged thyroid, and, just getting those second level scans done can be super helpful in just helping us to work out, is it actually something, quite serious, or is it something that we can just manage with medication?
Yeah, absolutely. So I guess the final question in wrapping up this morning is, what should you do if you have thyroid disease?
So taking any medication that you've been prescribed to normalize your thyroid function is really important, because as I mentioned right at the start, your thyroid affects like your heart rate, your metabolism, your temperature control.
Many things.
So, it's really important to not take, thyroid medication lightly, but, to actually remember to take it every day and take it as prescribed. Getting regular blood tests done as well, so that we can adjust your levels. Because people can go through various phases of their lives where they require a bit more of the thyroid hormone, and then for whatever reason, they then require a bit less. So, there's some fine tuning that we do in the course of people's lives if they end up on the thyroid medication. And of course, there's always like a lifestyle that minimizes inflammation can also be helpful. So this means having a healthy, balanced diet, plenty of plant-based products, making sure that you attend to your physical activity and get outside, getting enough sleep, and controlling stress levels in your lives. Like all of those things can be super helpful.
Yeah, and they're really basic tenets, aren't they, of just great overall health, but especially in people with thyroid conditions. These are super important things to do.
Yeah, absolutely. As a GP, we're always encouraging people to attend to those lifestyle things, to just improve their general health. But, it becomes even more important if you're dealing with some kind of an autoimmune or inflammatory condition. Because those things can, affect your outcome.
Yeah, absolutely. As always, a great pleasure to have you in this morning, Dr. Clara. Thoroughly enjoyed this one, as we do with every single topic of every month. So, again, thank you so much for coming in. But that's it for us this morning here with Dr. Clara Chu, our resident medico. Make sure you hang around, some more great stuff still to come. This is Rhema Brekky.